Equal Hope is a nonprofit whose mission is to save women's lives by eliminating disparities in breast cancer and cervical cancer and other women's cancers. There was research showing that women in certain parts of Chicago, specifically African American women, were dying at a 62% higher mortality rate than other women here in the city. Chicago is one of the most segregated cities in America, and it's due to systematic oppression. These inequities are contributing to health disparities.
Health equity is about access, and it's about equal treatment. Women of color, for instance, didn't have the same access. Equal Hope was established to begin the process of closing the gap between access, treatment, outcomes.
The COVID-19 pandemic played a huge part in the current disparities that we're out to fight. At the beginning of the pandemic, many of our breast centers actually closed. A lot of people ended up having delayed screening.
During the pandemic, we began to shift further our focus to how could we ensure that those communities had greater delivery of services, greater access to the vaccinations, greater healthcare oversight.
Almost 80% of the women we served in 2019 did not have a primary care provider.
Imagine for a moment that you are an adult in America and you've never had a primary care physician other than going to the emergency room where you receive your services. You've never had a mammogram or a cervical exam. There's a significant segment of the population that does not have that. That needs to stop.
I was diagnosed with breast cancer in 2009. Where I'm from, there are a lot of disparities in the African American, Black and Brown communities. A lot of people don't know that just because that they're underinsured or they don't have insurance, that there are organizations out there that can still help them with their medical needs.
Not having preventative care means uncertainty, instability, lack of engagement, fear. If you're going around with all those adverse things all the time, what is the likelihood that you're going to be a healthy, engaged member of society?
Over the last 12 years, Equal Hope has really made an impact. Equal Hope was able to help reduce the mortality rate from 62% to 42% for Black women. Equal Hope has become a staple in the community. With the expansion of our services, we're able to connect them to even more care. So that 80% of women who don't have a medical home that we did assess in 2019 are able to now get access to that and have a primary care provider who can really tend to the additional healthcare needs that they have going on.
People need someone to speak up for them, to be advocates for them. What I love about Equal Hope is that they can help people on so many levels.
Our advocacy efforts in Springfield and throughout the state has led to the continual funding of the Illinois Breast and Cervical Cancer Program, the program that allows women to access basically free breast and cervical care, and even those who are treatment to allow access and free services.
My hope for Chicago is that it becomes the beacon of hope for the nation. It becomes the example of what it looks like when you transform the lives of individuals by ensuring access.
When you think of hope, you think of the future. You think of what could be for tomorrow. And I think Equal Hope is constantly providing that for the clientele that we serve. Your financial support can help us go a longer way. It can help fund a breast screening for a mother in need. It can help fund a cervical screening for a daughter who's lost in the system, or can provide a medical home for a man who just doesn't know where to turn. Donating to our cause is one of the best ways to support Equal Hope's mission.